Good morning, I'm Sam Worthington, and welcome to Interaction Forum 2.1, which is our first virtual forum, and thank you for joining us this morning. Well, it's my great pleasure this morning to welcome a real special guest, UN Deputy Secretary General Amina Mohammed, to Interactions Forum opening plenary. And really thank you, Amina, for joining us this morning. And I hope that you and your family and colleagues are doing well during this and staying safe during this particularly difficult period in human history. And you have a vantage point on the world that's quite unique now, and it's now been it's slightly over a year since the WHO has declared a global pandemic, and we're witnessing, of course, health disruptions and so forth. But then it's been our issues around the economy, food security, humanitarian and social challenges and so forth, and particularly seeing this impact vulnerable populations. And just if you from where you sit, can you just reflect a bit on the global impact of this pandemic and what has it meant for the people of the world?
Well, thank you so much, Sam, for having me. And it's a wonderful constituency that we're engaging now, because I think without the partnerships and the coming together, we never would have got through this last year. As we began 2020, we sort of ignited the decade of action to the Sustainable Development Goals, 10 years to go. And then suddenly pause was hit on the world with COVID. And it presented itself as a health crisis, but very, very quickly it became a socioeconomic crisis. And that's where you can really see the burden of the shutdowns, the prescriptions to try to contain the pandemic really hit home for the most vulnerable. Women, of course, 50% of our populations have been hit hardest. They're on the front lines. They're also, those that are at home. So the unpaid care work that has fallen on their shoulders has been considerable. They're in the informal sector, less employed, first to lose their jobs. And so incomes into homes are big challenge to everyone. The gender-based violence that we've seen, considerable. But we're looking at the levels of poverty. I mean, millions of people have been pushed back into poverty, where, of course, inequality in many regions and countries was prevalent. This was exacerbated by COVID, and so making it even less likely for people to receive some of the social protection programs that were rolled out in the initial days. We saw health systems being challenged, competing demands. When COVID came, of course, it was an emergency response. But at the same time, there are existing diseases, and most of those, of course, with women. And in addition to those diseases, that children were on the front line there, and of course, maternal mortality. So things had to continue, but the systems were stretched. Weak as they were, we began to see the collapse of some of them. Education, all of a sudden across the world, children were out of education, which in many cases was more than losing education, was losing the only meal that they had a day with school feeding. And to find that in many cases, to get children back to school after that would probably be incredibly difficult to do. So many challenges for SDGs that were not on track. We were further off track as we went through the year, responding to the crisis of COVID.
That's a good place to end there, because I first met you a number of years ago when you did a very effective consultation around what eventually became the SDGs of engaging civil society and listening to different voices coming in. And as you noticed, we've lost a lot of ground over this past year. A sense of, do we need to continue to evolve the goals, or are they still fit for purpose? What are our sort of greatest challenges as we try to get the world back on track for what were these very critical aspirational goals?
Well, certainly they are goals that were framed at a time to do more than just the MDGs. MDGs showed us how we could goal and put attention and invest and get an outcome. And the SDGs were much broader, bringing together the economy, the environment, and the social aspects of it. So we were doing all of development, a huge paradigm shift for the way we invest in our economies and our people and the planet. I think that they are still as relevant as we gavelled them in 2015 today. In fact, they are the only frame that everyone sees himself in. and sees a road to recovery if they use that roadmap, the North Star, as we say, the SDGs are. So while I've sort of spoken about the rollback perhaps that we are facing now in education, in health, in poverty, in hunger, there's still the opportunity. And the opportunities are coming where we see that, in developing countries, stimulus packages that are being put together, how to ensure that there is fiscal space so that they can fund them. Again, the international response is so important, that global response to try to make sure we don't lose. And that's not come as it should. There have been some attempts, but it's not enough when we are seeing that, quite frankly, the volume of resources going in trillion-dollar packages, the stimulus are not even in the hundreds of millions in many other countries. So we need to make sure that the global community does step up in making more space available for financing for stimulus packages. Having said that, it's also an opportunity for us to leapfrog. In many of these stimulus packages, we're speaking about social protection programs. We're also speaking about the digital divide, the energy transition. So there's lots happening on the climate agenda where we're shifting in transitions to achieve the goals. So always the goals in mind, the integration of gender through all of them, because that certainly, as we often say, is our docking station for all other 16 goals. But in investments in particular aspects of the goals will help us to get the transitions that we need and possibly leapfrog. The digital divide, for instance, the skills that need to be taught, the connectivity that needs to happen, that's all happening now because there is an exigency for it and a pressure. And if we could just open up that space to ensure more resources are going into developing countries, we could begin to guide that expenditure so that we are, as I said, leapfrogging, and that we can recover not just better, but differently. So the response is really important, what we do as a global community in making the resources available so that we do recover better and differently.
It's interesting, in the US context, we pushed about 6 months ago to the US government. We were saying at least 20 billion needed to be invested into COVID broad response. And we're pleased with this last package that came up, where we've now reached a total of 18 billion that has been designated by the US to go globally. We think they have to go further. And I think the challenge, yes, is resources, but for the poorer nation states or different populations, and they have some of the tougher issues they have to address, so jobs, hunger, education. Have we done enough as a global community, or do we need to do a lot more?
Certainly, I think everyone needs to appreciate the efforts that have been made, because they are more than perhaps we had before, but they're nowhere near enough to respond to this kind of a crisis. This was a health crisis. The prescriptions that we rolled out for the COVID-19 crisis ended up with side effects in the socioeconomic sphere. And that itself will go on for many years after. The recovery from it is going to take its toll. And we can see this where countries don't have access even to the debt opportunities and initiatives that have been introduced by the G20. It's not sufficient to address some of these gaps. And even if you are able to be part of some of these initiatives, it could have an implication for your access to other private sector and financial markets, which again put you in sort of double jeopardy. So we have to rethink the financial architecture. We do have to think about how we make resources more equitable and accessible. It's not free money. I mean, countries are asking to have the opportunity with good fundamentals to borrow, but not to be borrowing at 7-8 times more than developed countries who have the wherewithal. So there are a lot of questions, tough questions that have to be asked. And we do hope that in the coming months, at the spring meetings at the World Bank and the IMF, at the G20, the G7 meetings, the General Assembly, the UN ECOSOC meetings, that leaders will be able to understand the implications, that it is in everyone's interest that we recover together. And in doing that, then resources have to be more readily accessible for countries to use them. And as I said, we're seeing ODA reduced. It's not ODA that's going to fix this. It's the ability for countries to have access to additional resources. Maybe, Sam, just to say one thing that has happened, it's not just about low-income countries, which of course are for us the most important. The furthest behind need to be brought further ahead. But we are seeing with middle-income countries, large populations, huge inequalities. That's a different kind of vulnerability that COVID has visited on their economies. And they need to be included in this response that we need if we're going to recover.
That was a good observation there. I mean, you see, even in this country context here, it's been vulnerable, marginalized populations that have been most at risk in many countries as this, and particularly inequality showing up stronger, exacerbated as we've seen them. But curious, your sense of how the UN is responding to this challenge. In what ways you think the UN has been able to step up, and what role have you been playing?
Well, I was on a trip in 2020 to Papua New Guinea, in fact, International Women's Day, and we were, making the case for reaching zero on gender-based violence, and then suddenly along came COVID. So I came straight back to the UN, and incredibly, our management, this institution, was able to take us online overnight. And that happened not just in New York or Geneva or Paris, but it happened in the field. And that connectivity was very important, but we also were able to facilitate this with many of our partners, be in the government and civil society. So we went into response mode very, very quickly to keep the world still connected and the issues still on the front burner. The policy briefs that were put forward to help people navigate what do we do now? It's very difficult in a virtual environment to feel as though you can connect to the ground and you can move things. And so I think a lot of the work that was done by country teams, the litmus test of our reforms, was to see the World Health Organization working together with our country teams and governments to respond in the early days of COVID. Then, of course, we had to turn development into an emergency. And so to work with countries with their stimulus packages, with what we call the socioeconomic responses, be very specific as to what does the investment beget you. Social protection, make sure people are kept in a job, and if they're not, that there is a traveling of them to a platform that is digital, so that they can continue to do their businesses. To really put a spotlight on women who are vulnerable, particularly, as I said, with gender-based violence. Many of these women, you're prisoners of your perpetrator of the violence when you're in home, right? So to really try to make sure we were able to reach through communities, through civil society, NGOs. These were the bedrock of those who helped us with service delivery, with voice, with amplifying and putting light on a place where we're not quite seeing. So with the UN, I think it's a partnering that has been great, and with civil society and NGOs. Even when we're talking about the shrinking space, I can say that a lot more happened. It was a lot more inclusive, a lot more partnering to get things done on the ground. Certainly without our partners in civil society, this would not have happened.
Also, I mentioned earlier when we were chatting before we started here, I just wanted to thank a number of UNHC heads who engaged through the Interagency Standing Committee and a very good dialogue engagement, but also in terms of reforms, various things we'd wanted to improve within the UN, we found could actually be accelerated during this period. And I think one of the challenges, sort of one of the silver linings we see, but one of the real challenges has been one of this whole broader issue of equity and access as there. And I think as we move in this case in the United States and Europe and others towards vaccinations and where you are and what percentage of population is moving, the reality is that mass vaccinations, which we all need for our own safety and our own well-being as human beings, will take months and years. Curious to get a sense of what is the UN doing for this broader sense of vaccine access, and is there a moral sort of cry that needs to go out there? And I've heard the Secretary General mention us not stepping up the way we should. And what can be done to improve the systems, particularly for the most vulnerable people, in terms of this core need of having access to vaccines?
Mhm. Well, thank you for speaking about our agencies. I mean, clearly on the ground for the socioeconomic impact, UNDP and many of our UN family have been stepping up in supporting that. But when it came to the response, early responses on COVID, of course, WHO leading that, now we are in this mode where vaccines need to get to everybody everywhere. UNICEF, together with WHO and Gavi, and SEPI, all of them are PAHO, are all ready to distribute, already distributing in some cases. The real challenge we have is that the well-designed ACT accelerator with the COVAX facility has not been fueled, not with the resources and not with the vaccines. And vaccine nationalism has taken hold. To the extent that you have more than you require. And I think that that's what we really need to step back from. Absolute justification in a leader putting their people first. That's what they're there for, to keep them safe and to make sure they have access to what they need to protect them, but not at the expense of others, because where there is COVID, it will always be. And we've seen the variants, we've seen how quickly this spreads. And so it has to be the global plan that the SG is asking for vaccination, is how you do this at the same time so that every healthcare worker, frontline worker, gets it at the same time, and then progressively the rest of your population. And I say this more so for developing countries, because already with weak systems, insufficient number of health workers, you can't afford to lose them. And they are at risk. And so therefore protecting them first is so important. And I hope that, people will hear this, because they're not just people, they're heroes and heroines who every day are going out there risking their lives. I believe that there are many issues around this. One of them, of course, the SG has spoken to, is a political will to have the resources to ensure that these vaccines will be made available and distributed. The second, of course, is with the industries themselves, the incentives that we need to give to make sure that the production of the vaccines can happen, not just in developed countries, but also in developing countries at the scale and urgency with which they are required. And that sometimes will require a lot more negotiation than we've had. And every country needs to know that we're dealing with a global emergency pandemic. That makes it different. That makes the vaccine a global public good, because we are so connected that's just a reasonable thing. As I say, common sense is not very common right now. And I think that this is the pressure that we have to put, is that just keeping a certain number of people in a privileged area covered by vaccines is not going to save the world. It's not going to bring us back to where we need to be and much further ahead. So political will, resources, productivity. I mean, we have to produce the vaccines in the amounts that they're needed, and then we have to make sure that they are accessible and free to those who need it, the poorest, the most vulnerable, and those who risk their lives every day to save others.
No, we've been mirroring and echoing this call that we're, none of us are safe until we're all safe, or none of us are, in a sense, in terms of variants to the COVID and so forth over time, that will only stop if we're able to vaccinate the whole world. So there is a both a moral imperative, but also a self-interested thing of a global pandemic. And we found this resonates quite well with current leaders in the Senate and others for resources to invest, and we'll continue to push on this topic. And I'm curious, we're always used to asking the UN, others to engage in different ways. If you looking at, whether it's the NGO sector or broader civil society, what role can we play in trying to be as constructive as possible during our sort of second year of this pandemic, and as we deal with some of its secondary, which are not so secondary causes, but some of the broader socioeconomic and political impacts that we're seeing?
Well, maybe I start with first of the vaccines. I mean, there has been nothing more important than having the knowledge about them. Also, we've seen some step back from vaccines because they don't know, they're afraid. And so I think there's a lot of work there to partner with on this is the information and how do we communicate this to communities and populations that we hope when it's available, they receive it. And I think it's important that people also know that once you've had the vaccine, it doesn't mean that you can be a carrier and you can give someone else COVID. And I think that that's important. It's not just about you, it's the risks that you then become to others if not everyone is vaccinated. So there's a lot of information around the vaccines that needs to be communicated. Civil society, NGOs have been most powerful in this response to the crisis with their voice. I think it's very important never to underestimate the voice, and the voice that's found itself in many different platforms of social media, of the traditional media, in community places, because they are in those communities, and so therefore can bring the messages to the community, but also to government and to other players who are opening up possibilities to respond. Service delivery. In many, many cases, service could not be delivered by the usual means, and it is civil society and NGOs individually and collectively that have been able to do that. That, I think, needs to be supported more because I think, as you've said, this is going to go on through this year into the next year. So those that have been left behind are further left behind, and we need to make sure we shore that up, that it doesn't continue to slide. Therefore, finding innovative ways to continue to increase the partnerships with the NGOs and civil society to be our partners in the community. Capacity building, a lot of capacity building in new skills that are needed when you take things online. Getting young people engaged. I always say that, COVID's opportunity is in the intergenerational transition and how young people are going to take this baton and run with it into this brave new world. But that's going to require for them, with their peers, to bring them all on board with the digital capacities that you need to close that gap. So it's not just the availability of infrastructure, but once you get the tools and the instruments, someone's got to teach you. I've never seen a faster, easier way than when peers get together amongst young people and they do this so effectively. So again, to capture that energy and the possibilities there. Really important that we are encouraging the campaigns, whether they are vaccine campaigns or more campaigns to address governance, rights issues. I think now we can strengthen that. There's an appetite for it. There's an opening where people are questioning governance. The social contract is not in a good place in many, many countries. So this opens up a space for us to partner, convene, to make sure we don't forget that Goal 16 matters in setting the environment for all the goals to be achieved and the partnerships to be had. And I will again end on the importance of the voice and the efforts that needs to happen to make sure that the vaccine becomes a people's vaccine, that there is global solidarity to have that done so that we can recover quicker. Right now, we are still in response mode, and we need big response to get that done.
No, and thank you very much, because I think you captured very nicely the critical role that the United Nations plays, both as a convener, a sort of moral compass, but also bringing together governments, nation states, and civil society, private sector, and others in this. I think this is one of the first time in sort of all our lives where we've seen this, that we cannot solve this on our own. So really, thank you to as Deputy Secretary General Mohammed has joined us just now, and really appreciate your time, your energy, your leadership, your willingness to reach with us. And we'll be following this conversation with some comments from Natalia Kamen, the Executive Director of UNFPA, who's going to share some reflections on what we've just shared here, but from the perspective of a 12-year-old. So, Amina, thank you very much, and appreciate your joining us this morning.
Thank you very much, Sam. It's been a real pleasure. Look forward to working with you through the year.
Dear friends, imagine a girl. She's about 12 years old. She loves school and dreams of finishing her studies, finding a decent job, and starting a family when she's ready. Only now, due to COVID-19, her hopes are evaporating. Her parents are jobless due to the pandemic, and many nights she goes to bed hungry. Soon she will drop out of school to get married and lessen the family's economic burden. With no contraception and no say, early pregnancies and childbirth, predictably, her fate. Standing at the threshold of puberty, she faces a lifetime of poverty, powerlessness, and missed opportunities. COVID-19 is exposing huge fault lines. And who is it that's the hardest hit? The poorest and most vulnerable people, and those who are of African descent, indigenous peoples, older persons, migrants and refugees, people with disabilities, and those with mental health needs. They are hardest hit. As always, in times of crisis, women and girls are bearing the brunt. We've seen gender-based violence skyrocket and sexual and reproductive health services disrupted. Child marriage, female genital mutilation, and adolescent pregnancy are all on the rise. A devastating toll, but it could have been much, much worse. Fortunately, as an international community, we pulled together, we innovated, and above all, we showed up for the woman trapped in lockdown with her abusive partner, the expectant mother who needs a midwife, the young girl who wants to avoid child marriage and pursue her education. Still, millions more are waiting. At UNFPA, the United Nations Sexual and Reproductive Health Agency, we advocate for a world where every woman and girl's body is her own, bodily autonomy, because we need a sea change in attitudes. That means more partners, more advocacy, and more persuasion. So I urge you to use your abundant energy, passion, and compassion on behalf of anyone whose voice is silenced by violence, whose bodily autonomy is stolen from her by harmful practices or abuse. And do enlist others in your organizations to stand up, speak out, and act. Ending sexual exploitation and abuse is a matter of dignity. Yet it's also a matter of power. Please use your power as humanitarian and development professionals to make sure that every woman and girl's sexual and reproductive health, rights, and bodily autonomy are protected and respected. Quoting Audre Lorde, "Life is very short, and what we have to do must be done in the now." Let's work together, guided by data and our commitment to human rights, for that more just, equitable, and prosperous future we all want, for ourselves and for that 12-year-old girl. Thank you.